In 2016, two of Africa's largest countries came close to a public health disaster.
This year's appearance of urban yellow fever in Africa, now confirmed in the capital cities of Angola and the Democratic Republic of Congo, is yet another serious event.
The outbreak is spreading to other provinces, first of all from the epicenter in Luanda, where it had started, is spreading to other provinces in Angola, and we are getting worried that it's going to spread into other countries.
These first cases were located in Kinshasa, and we said this great capital had more than 10 million inhabitants.
I'm Nika Alexander from the World Health Organization's communications team. In this, the first episode of our new series, we explore how an outbreak of yellow fever posed a real global threat, and how a brave experiment to split the limited supply of vaccines into smaller doses helped curtail a growing epidemic.
We were quite convinced it would work, but it was less clear to what extent it would be working. Personally, for me, it was a very tense moment.
The risk of outbreaks of the deadly disease yellow fever is both significant and growing. This is down to a cocktail of contributing factors, including climate change and increasing pressure on land, greater movement of people, particularly into cities, and a resurgence in our highly connected world of the mosquito species that carries and transmits the disease. Yellow fever may not be the most obvious global public health threat, but it's a disease with no cure and a growing risk that must be taken seriously. We are Eliminate Yellow Fever Epidemics, that's I for short. From the world's most senior public health experts to those on the front line of combating this deadly disease wherever it emerges, we have the inside story on yellow fever's expanding global risk. This is Eye on Yellow Fever. Hi, and thanks for being with us. Over a series of 10 episodes, Eye on Yellow Fever takes you inside the concerted global effort to control one of the most deadly diseases we've ever known. We'll explore the 3,000-year history of yellow fever and explain why the disease has the potential to be a major threat in years to come, despite there being an effective one-shot vaccine for it. But we begin with the story of a recent yellow fever outbreak that was deadly, but saved from being much, much worse by some incredibly rapid and courageous scientific advances, and that resulted in the creation of the I strategy, a coordinated global effort to prevent and contain outbreaks and end yellow fever epidemics within 10 years. In this episode, we're hearing the story from some of those who were there. It all starts in Angola, on the west coast of southern Africa, early in 2016.
I'm Dr. Ambrose Talisuna, and I'm Team Lead Emergency Preparedness at the WHO Regional Office in Congo, Brazzaville. I was the WHO Incident Manager for the outbreak of yellow fever in Angola and the Democratic Republic of the Congo.
The World Health Organization was responding to the outbreak on the ground, along with UNICEF, Gavi, the Vaccine Alliance, and the ICG, the International Coordinating Group on Vaccine Provision.
I had just joined the WHO Regional Office, and I was immediately put in the furnace because I was made the Regional Incident Manager for the two outbreaks.
So, on Dr. Talisuna's very first day, he is given a pivotal role in tackling a yellow fever emergency. Put in the furnace, indeed.
Immediately after I report to the director, he tells me that there is a meeting to address the ongoing yellow fever outbreak in Angola.
What are you discussing at that meeting?
It's a 3-level meeting between WHO headquarters, WHO regional office, and the WHO country office in Angola. The cases in Angola had been reported, so we are discussing cases, and that morning,
yellow fever cases had been discovered in Angola's capital, Luanda. From 23 initial cases, the outbreak grows exponentially and spreads across Angola. By March 9th, there are 138 deaths. Dr. Talisuna's furnace is fast becoming a wildfire, and worst is yet to come.
The outbreak is spreading to other provinces, and we are getting worried that it's going to spread to other countries. We need to make sure that we limit local transmission in the countries where it spread.
Is that the day, though, you heard about some cases in China?
Yes, some cases from Angola are reported to have been imported into China, and also we are discussing some of the cases that have been imported into the Democratic Republic of Congo.
What are you thinking that day? It's your first day on the job. You're starting in on a very important position in the middle of a crisis. What were you thinking that day as you were hearing these reports?
I mean, the situation was really evolving very quickly. The bad scenario was getting local transmission in the DRC, where now imported cases had been reported.
A clear marker of an outbreak taking hold is when the disease starts to be transmitted around populations with no connection to the virus's original source.
And if you imagine this happening in a densely populated context,
This is Dr. Joachim Hombach.
like a city like Kinshasa, a multi-million densely populated city, you can imagine the crisis that can result. Because yellow fever is a disease that has a pretty high mortality rate. It's a very serious disease with lots of casualties.
Later, Dr. Hombach and his colleagues will be key to getting this crisis under control, but we're not there yet.
Before we heard about the epidemic in 2016, I was with the entire team at an office meeting going over our standard agenda. We were holding our normal coordination meeting.
In Kinshasa, the capital of the Democratic Republic of the Congo, Dr. Moise Yapi Désiré is running the WHO team responsible for monitoring vaccine-preventable diseases.
And then we got a call from a colleague in the lab who told us that we had just received information that there is an outbreak of yellow fever from results that had been sent to Dakar. That's how they gave us the information.
Donc c'est comme ça qu'ils nous ont donné l'information. On était
As soon as we got the information, we were a little worried and we were afraid because these first cases were located in Kinshasa, and we said, wow, this great capital had more than 10 million inhabitants, and with this epidemic, we are really screwed.
Dr. Ambrose Talasuna again.
Kinshasa is a very populated city, and so we are really worried that if we have a full-blown outbreak with local transmission in Kinshasa, we really have a tragedy on us with possible spread to the rest of the world, because it's a transport hub and is linked to several countries in the Great Lakes region, but also several flights in and out of Kinshasa. And now here we have what is turning out to be the hugest yellow fever outbreak in recent years.
donc on était
So we were scared. We were a little stressed. We started to panic a bit.
à paniquer un peu.
I can hear it in your voice. You're really anxious. Is that what you are thinking about most?
At that time, really, the best measure to stop the outbreak from spreading further is to do reactive vaccination. So you kind of surround the outbreaks and vaccinate all people at risk or people who are likely to get the disease and be able to cut it out.
Okay, so maybe this doesn't sound too serious. After all, yellow fever has a single-dose vaccine, which means one shot protects you for life. So you get everyone in the area vaccinated as quickly as possible, and the problem goes away, right? Wrong.
The stockpile for vaccines was very, very low. Our fear is if this spreads, we will not have enough vaccines.
So at that time, you're looking at the supply. There's 6 million doses of vaccine in the stockpile.
It was really 6 million, which was kept in the stockpile. And so there are not enough vaccines, and we are beginning now to start to plan to do reactive mass campaigns in Angola, and you really have to start from places which have not yet got cases and move towards the epicenters of the outbreak, because that's how you burn out the fire.
So there are 6 million doses held in a global stockpile, but in the first half of 2016, 19 million doses are requested. And that's a huge problem for Dr. Moïse Yappé Désiré.
On avait très peur parce que les vaccins...
We were very afraid because there were no vaccines for Kinshasa and the population had already started demonstrating, saying that you have declared the epidemic. We need vaccines. We must be vaccinated.
Donc nous avons besoin de vaccins, il faut nous vacciner. Alors comment il fallait faire pour avoir le...
So how did we go about getting the vaccine? The minister had to communicate with his cabinet.
Il a fait une conférence
He gave a press conference
presse
informing that the government,
que
along with
le gouvernement
its partner WHO,
dont l'OMS sont en train de
is looking for vaccines globally, but that there is a shortage.
mondial. Mais sachez déjà que il y a une pénurie de vaccins.
When do you start hearing about the idea of reducing the dose?
Dans le contexte
In the context of the epidemic
des pénuries
and the shortage,
mondiales, pénuries,
the global shortage of vaccines, we said we had to give it a go.
il faut y aller.
Coming up, an experiment to split the depleted vaccine stockpile into smaller doses to stop a growing epidemic.
We had question marks. We were quite convinced it would work, but it was less clear to what extent it would be working.
And how that experiment was communicated to millions of people gripped by fear.
Okay, you are hungry and you must eat,
Vous avez faim,
but we do not have enough bread.
vous devez manger.
We have a loaf of bread, but for 100 people.
Suffisamment de-
So what do we do?
On a
We'll continue our story shortly. If you're interested in global health, check out the Global Health Matters podcast. Host Gary Aslanyan is joined by some of the world's leading scientists who share experiences and views on different aspects of global health research with a focus on perspectives from low and middle income countries. The podcast launched in the spring of 2021, and so far, Gary and his guests have discussed research in the time of COVID-19 and how research communities in Africa have tackled the pandemic. They've also done an episode on women in science. Check it out. It's called Global Health Matters with Dr. Gary Aslanyan. You can find it wherever you get your podcasts. So to recap, it's midway through 2016 and yellow fever is raging through Angola and the Democratic Republic of the Congo. Requests for the vaccine have exceeded supply threefold. This acute shortage of vaccine, which is absolutely essential to even stand a chance of combating this wildfire outbreak, is what brings Dr. Joachim Hombach and his colleagues onto the stage from WHO headquarters in Geneva.
This outbreak was just too big, and the stockpile was depleted. There was not enough vaccine available to respond appropriately. And this is what brought us into the field in order to see what solutions we could bring to this major crisis.
Dr. Hombach is a senior advisor in the World Health Organization's Department of Immunization, Vaccines, and Biologicals. He's about to begin what he acknowledges is a risky move.
In these countries, we knew that the coverage with yellow fever vaccination of the populations was overall low, which means that most people were not protected against yellow fever infection. On the other hand side, we knew that there was insufficient amount of vaccine to run the necessary major campaigns. If you want to provide more vaccine, there's very few opportunities that you have. The one you could casually think, well, let's quickly increase the production of the vaccine. This is not an option because vaccine manufacturing is a very complex undertaking, and there is a certain capacity that the companies have in order to produce, and you just cannot double, triple it overnight. This takes major investments into infrastructure. It's also that the production cycle of vaccines are long. So it may take 6 months or a year for a vaccine to be produced from in the initial inoculation to grow the virus until you have it in the vial ready to be administered to a person. The other option was to get more out of the available vaccine. And this brought us to the issue of considering to fractionate the dose of the vaccines that we had available.
Fractionate the dose. The principle is straightforward, even if the science is not. What is being proposed is to simply split the usual dose into 5, meaning people get a fifth of a normal dose, but that the stockpiles available can be stretched to give a measure of immunity to 5 times more people. Will it work?
We had question marks, and we were quite convinced it would work, but it was less clear to what extent it would be working. We were pretty sure, and the evidence was quite clear, that we were not expecting a safety concern. We were less clear about the extent it would be immunogenic and protective. Personally, for me, it was a very tense moment.
The mission, then, to fill in the blanks in the science, to convince public health officials in country that these 1/5 doses will make the necessary difference, and to do this in a deadly race against an expanding and worsening yellow fever outbreak. It soon becomes clear the DRC government is more receptive to this innovation than officials in Angola.
So what we did is actually we convened a small but very high-powered group of experts, and we involved really from the start scientists from the Democratic Republic of Congo to participate in these discussions and to participate in the planning, the assessment, and developing the rationale for doing such a large-scale fractional dose administration of the yellow fever vaccine.
Dr. Moïse Yapi-Désiré again.
Un certain échantillon de personnes qui allaient recevoir
So a sample of people who were going to get a vaccine was going to be taken, and we were going to monitor the immune response a bit to see if the vaccine was going to protect for a long time.
ce vaccin-là ils allaient être protégés pendant une longue période.
Over time, and with hard work and collaboration between the WHO, UNICEF, Gavi, and the ICG, the evidence supporting the 1/5 dose theory mounts. Dr. Hombach and the expert group gathered to secure and then share this evidence are able to say with confidence it can and will control the outbreak.
Of course, visually, it's very simple. You just take the fifth of the volume. Instead of 0.5 milliliter, you administer 0.1 milliliter. So that's pretty straightforward. What it actually means in terms of the vaccine and in terms of the immune response is pretty complex. The amount of antigen or virus you inject and the response that the vaccine triggers is measured in the laboratory. We knew for yellow fever that what is essentially put into the vial is very often significantly more than what is the minimum threshold. Also, even if you store the vaccine for a prolonged period of time, the vaccine is still sufficiently potent even if you have stored it properly for 1 or 2 years. And so we knew that if we would be administering a fifth of the dose with a vaccine that was essentially fresh from the factory, we knew that the potency should be sufficient. If everything runs well, it's not an exact science, I have to say, and that's why we had no full certainty about this, but this was the principle that was behind this.
The idea with the fractional dose then is that the science seemed to show that yes, it could give an immediate boost in immunity, but it's just a question of how long it would last. Is that right?
Yes.
Dr. Ambrose Talasuna again.
And how long it would last, we need to study this, but at least and the science then was showing that it can control the outbreak. And then I think the critical piece that I want to do at that time is to control this outbreak and stop transmission, and then we can look at the duration of the immunity, and once the outbreak is controlled.
It's one huge hurdle cleared, but there are still challenges. A much smaller dose requires smaller syringes that weren't readily available. These had to be procured. In Kinshasa, radio, TV, and billboard campaigns are put in place to persuade a worried and skeptical population that the much smaller vaccine doses they are being offered will still be effective. Dr. Moïse Yapi-Désiré again.
On a fait plusieurs
We tried to convince the population that split doses would work. We held several awareness sessions which were broadcast on radio and television and even by the Minister of Health, who also raised awareness. So, the message he tried to give is that he took an example, like a down-to-earth example, to say, okay, you are hungry and you must eat, but we do not have enough bread. We have a loaf of bread, but for 100 people. So what do we do?
On a un pain, mais pour 100 personnes. Alors, qu'est-ce que nous faisons?
So we are going to take the bread and cut it into 100 little pieces, and we're going to give that to everyone.
When did you start to see a shift? When did you get a sense that this is going to work?
By June, we start seeing declining trends, in both countries, in the DRC and Angola. Fortunately, the imported case in Kenya doesn't result in local transmission, and also the imported case in China doesn't result in additional local transmission. And then the trend keeps going down, and by October, we are seeing the end of the tunnel, and we are about to declare the outbreak over.
Tout le monde avait peur au départ, mais
Everyone was scared at the start, but at the end of this situation, we were satisfied and we said, oof, Kinshasa was not burned down by the yellow fever epidemic.
par l'épidémie de fièvre jaune.
The experience and our work made me indeed proud, and I think it showed that if everybody plays their respective roles, you can actually get an incredible work done.
I think for me, the most reassuring is the speed at which we vaccinated in Kinshasa. I mean, we vaccinated 9.8 million people in 10 days. I think that is the turning point for changing this outbreak. First of all, stopping it to spread outside Kinshasa and and then controlling it in Congo, in the DRC, and ultimately actually then slowing the spread in Angola and limiting the spread out of the two countries.
This actually makes me proud that I had an important coordinating role in this, and it showed that the different parts that we have in the different organizations and agencies that we have and their respective staff really have great roles, and if you put them all together, you can actually make a difference in a situation of crisis. So for me, this was a great example of how things can really work out to the best.
What this story underlines is how close we came to an even more deadly and widespread outbreak. If the virus had taken hold in China or Kenya, or if the science on fractional dosing hadn't moved ahead so smoothly to turn the tide in Kinshasa, we could have been looking at a much more serious multi-country epidemic with nowhere near enough vaccine for even fractional doses. Huge thanks to Dr. Talisuna, Dr. Hombach, and Dr. Yapi for sharing their experiences of that very difficult, tense, and frightening time. Something we'll be peppering through these episodes is links to onward journeys and further reading about the I strategy online. A great place to start is the homepage for the I strategy. Just search online for Eliminate Yellow Fever Epidemics. We've also put a link in the notes for this episode, which you'll find in your podcast app. That 2016 outbreak is what set wheels in motion for the creation of the I strategy and the bringing together of a multi-agency partnership determined to put an end to yellow fever epidemics. That's where we'll pick up the story next time in Eye on Yellow Fever. This episode was produced by Dave Howard with research from Amelia Janssen and sound design by Adam Whaley. I'm Nika Alexander. Eye on Yellow Fever is a Bengo Media production for Eliminate Yellow Fever Epidemics.